Hey everybody, I'm Jacob Dye, licensed professional counselor and mental health service provider here in the great state of Tennessee. I'm coming to you again today to talk about a particular and very specific mental health disorder. But before I do that, I want to ask you a question. How do you feel today? Are you feeling happy? Are you feeling sad? Are you feeling depressed? Are you feeling anxious? Are you feeling tired? Are you feeling grumpy? All of these different feelings are, very natural and, very common emotions that all of us experience, day in, day out. But more often than not, I would bet that you, like I, wake up feeling pretty happy, right? Well, there are about 2.6 million Americans who suffer from a mental health disorder known as bipolar. Now, you may have been called bipolar at some point. Odds are you are normally a happy person, but then all of a sudden you behaved in such a way that you were really irritable, or you were really anxious, or you were depressed, and the person's like, oh well, you're just bipolar. Okay. Well, today I want to kind of clear up some things about bipolar disorder. It is characterized by two different types of moods that a person may experience. The first mood is a mood that we call mania. This is a high mood or an elevated mood. And the second mood is depression. Now, before I get into what is mania, what is depression, I want to talk to you about the 5 different types of bipolar. There's first bipolar type 1, and in this type of bipolar, a person experiences both depression and mania for various lengths of time, and they experience both pretty equally. Okay? The second type of bipolar is bipolar type 2. This involves a person having very mild, or I guess a milder manic state. But the depressive states are just as severe as a person who has bipolar type of bipolar. The third type is something that we call cyclothymia. Cyclothymia is a very mild form of bipolar, but it's also a much more, chronic is a good word. It's a more chronic form. A person to be diagnosed with cyclothymia, something that we call must experience these mild depressive and mild manic states for at least 2 years. Okay? The fourth type of bipolar disorder is what we call a mixed episode. Okay? In a mixed episode, a person experiences both depression and mania at the same time. And you may be thinking, but Jacob, how is that even possible? Those are two completely separate things, right? Well, to an example, they may feel tired and depressed and sad, but at the same time, they also kind of have this internal pent-up energy that they feel they need to get rid of, and they have these grandiose ideas and feel eager to engage in very high-risk activities. The fifth type and final type is what we call rapid cycling. Rapid cycling bipolar, to be diagnosed with this, you have to experience at least 4 depressive, manic, or both states within 1 year. So I've thrown out the term manic several times. I've thrown out the term depression a couple times. What does that mean? Well, I have my notes, and I'm going to refer to those so I can be as accurate as possible. Mania is traditionally characterized by, first, a sense or a feeling of euphoria, a feeling of elation, or a sense of irritability. Okay? It's also characterized by someone who would, or during this time, you would engage in very high risk, very impulsive activities like going on a shopping spree. And we're not talking, we're not talking about $100 here. We're talking, thousands and thousands of dollars, racking up a large amount of debt in a very short amount of time, blowing through an entire life savings in a very short amount of time. And when we say high risk, that's both impulsive and high risk, but it's also, driving recklessly, engaging in, races on the street with the person that pulls up next to you, sleeping around, and engaging in a lot of unprotected sex. Okay? The next symptom of mania is aggression. Now, if you remember at the very beginning, I said a person may be irritable. If you are feeling irritable all the time, odds are you're going to also be impulsive with that irritability, and you're going to act in a very aggressive manner. The next symptom is this increased energy or rapid speech. The person who normally talks about like this may come up to you and they're talking real fast like this, and they've got all these really big ideas and they want to tell you about them, and they got to go and got to go, got to go, got to go. Okay, that. If someone comes up to you and they're normally talking with a normal rate, and all of a sudden they have this pressure to speak, and they're just going and going and going and going faster and faster, this may be a symptom of mania. They may feel an inflated sense of self-esteem. I don't really know any other way to put that. I mean, all of a sudden they're going to think they're the next best thing to sliced bread, and they're probably better than sliced bread, and they're going to tell you all about it. With mania, you're also going to experience both a decrease in sleep and a decrease in appetite. When I say decrease in sleep, I'm not talking going from only needing 8 hours to needing 6 hours. I'm talking they may only get 3 hours of sleep and they're completely rested. In extremely severe cases of mania, someone who their manic state has gone unchecked for days up to weeks in duration, they actually can experience delusions and hallucinations, like the FBI's following me. They may hear voices. And as a side note, this isn't really in the DSM or anywhere else, but through my experience in talking with clients who have bipolar disorder, they often, regardless of what type of bipolar they have, when they're about to experience a pretty bad manic episode, they report that they'll often, upon waking in the morning or just before going to sleep at night, they'll hear their name. Like it sounds like this disembodied voice kind of somewhere saying their name, kind of like Jacob. And if you experience that, if some of this sounds familiar and you're experiencing that, I would really encourage you to get to a therapist, to a doctor, to a psychiatrist as soon as possible. Because through my experience and with my clients, that's indicative of a pretty bad manic episode or sometimes depressive episode coming on. Okay? Now, depression. In my very first episode, I kind of talked about the situational depression, where maybe you're thinking too much about the past and trying to change the past or trying to control past decisions. This is clinical depression. So, and just like mania, we're going to describe what depression is. And depression, clinical depression, is not solely limited to feeling sad. Now, yes, that is a symptom. It's this feeling of hopelessness, despair, sadness. Also, an inability to sleep, or you sleep too much. If you're suffering from depression, you may not be able to get to sleep. You're tired, you're fatigued, and you want to go to sleep, but you just can't. It's almost like you're too tired to sleep, is what people say. Or, on the flip side, you may be sleeping 14, 15, 16 hours a day. That's not unheard of. It's also a loss of interest and a loss of energy. This loss of interest, there's a word that describes that. I'll teach that word to you today. That word is anhedonia. I'm pronouncing the H, so you know it's there. Anhedonia. Anhedonia is interest, loss of pleasure in previously enjoyed activities. So for me, I'm a runner. If I were to experience a depressive state, and when I have experienced a depressive state in the past, all of a sudden running just, whatever. I can go knock out my best time that I've ever run, and it's still just kind of like, whatever. I don't care. So those are some symptoms. Some others, a change in appetite or weight. You'll either have a large increase in weight in a 3-month period. This is about an increase or decrease of 20% of your body weight. So if you weigh 200 pounds, and I hope my math is right here. If it's not, I'm sorry. If you weigh 200 pounds, an increase, you'd go up to about 240, and decrease, you drop down to probably about 160 or so. If that happens over this course of 3 months, it's one of two things. Either the holidays happened, or it could be a sign of depression, especially if these other symptoms are present. This feeling of worthlessness, a sense of guilt, you just all of a sudden are overcome, and it's this chronic, ongoing guilt that isn't really appropriate. It's an inability, or it's indicated by an inability to concentrate or to make decisions. And finally, it's indicated by reoccurring thoughts of death. Individuals who suffer from bipolar are at a high risk for suicide. More likely during a mixed state or a depressed state, but it can happen during manic states as well. And if you are experiencing these recurring thoughts of death and thoughts of hurting yourself or hurting others, again, I would encourage you and implore you to seek help, whether through a professional counselor, much as myself, or find a psychiatrist, or even your family practitioner can at least get you started on something that can help. I hope today has been informative and has been helpful. In the mental health community, there is a lot of work being done to try and take the stigma out of mental illnesses. Our bodies can get sick, and our brains can get sick too. People don't choose to be bipolar. It is a chemical imbalance in their body. So if there's someone that suffers from bipolar, please be patient with them, love them, try and keep them accountable. You can have long-term success with bipolar, but you have to stay regular with your medication, with therapy, and just good accountability at home. Again, hope today's been helpful. I hope you have a wonderful day today, and I look forward to talking to y'all next week. Again, if there's any topics in the future that you'd like to discuss, please leave that in the comment section below, or send me an email or a message on Facebook, or leave it on YouTube, whatever. I'd be glad and happy to talk about any topic, but if you don't ask, I don't know what you want to talk about. So I hope you have a blessed day, and I'll talk to y'all next week.